UNICEF and IHD, I accord my warm welcome to all of you, the people who are on the screen, panelists, the speakers, as well as all participants who are joining in large number. 140 people have already joined and they are joining, who have joined this lunch event of the UNICEF-IHD report, assessing impact of COVID-19 pandemic on the socio-economic situation of vulnerable population through community-based monitoring and the panel discussion. Friends, COVID-19 is the biggest public health disaster in more than a century, which the world has witnessed. It has led to unprecedented disruption and distress in people's lives all over the world, and the government across the world swiftly responded to this disaster. The Indian government also responded quickly and declared a countrywide lockdown when the pandemic had started spreading, which certainly helped in containing this virus. We witnessed a second wave, which, although very intense, did not impact so much adversely the livelihoods as the first wave, because there was selective lockdown. There is a speculation about the third wave, but hopefully the country is now in a better position to face it, if it happens at all, because of the preparedness, and also that a large number of people, something like 100 crore people, I understand, have vaccinated, and maybe in 3-4 months, the entire country will be vaccinated. So this report is based on community-based monitoring, which was undertaken by civil society organizations with the help of community volunteers from 22 districts in 7 states, both rural and urban, and it was coordinated by UNICEF. This community-based monitoring was undertaken in 4 phases from June to December 2020. Our marginalized sections of the population, who have already been battling poverty, malnutrition, and similar challenges, were more adversely affected compared to relatively better sections of population. And this is not from this study, this report, but also a number of reports, other data have shown that the marginalized sections were affected much more. The story of the migrant workers who lost their livelihoods and marched to their villages is now well known. Many families lost their earnings and livelihoods overnight. The voices of the vulnerable people needed to be heard by the policymakers, which also posed a problem with people being confined to their homes and restrictions imposed on the movements of goods and services. The impact of the pandemic has been really very hard on education, with schools closed and with digital divide between haves and have-nots. This report brings out all these voices of the vulnerable population as they were experienced by the people, and it is in the first wave. As I said earlier, this is based on the CBM report from June to December 2020. Although it doesn't cover second wave or anything else, but I think it is very important to learn lessons from the adverse impacts of the pandemic and our responses to it, where we succeeded, where we did not succeed, which sections of the society suffered more, which sections relatively less, and what have been the policy impacts here. where it worked more, where it did not work more. This will be very helpful in devising policy responses in similar situations when the other events take place or even now. The report also brings out the positive sides where government institutions such as hospitals and Anganwadi centers became much more gradually functional as compared to the situation prevailing immediately after the lockdown. Social protection schemes such as public distribution system, Mahatma Gandhi National Rural Employment Guarantee Scheme proved to be lifelines for the vulnerable population. Other social protection schemes did not prove to be so effective. Our Panchayati Raj institutions, by and large, also worked. For us in ISD, it has been a very enriching experience to partner with UNICEF team in preparing this report. Our responsibility was to contributing to questionnaire, data processing, analyzing it, and report writing. And of course, regular feedback to the field team. Regular interactions took place with UNICEF team comprising Ms. Mishaki Aksaka Veda, Mr. Maiti, Antara Lahari, Chayan Rai Chaudhary, Urvashi Kaushik, and on behalf of ISD, I give my thanks to all of them. From ISD team was heavily led by Professor Tanuka India, who will be making the presentation today, and which was supported by Tanusri Kundu and Prashant Arya. The production and communication team was led by Priyanka, and which comprised Aditi Madan. Professor Ravi Srivastava, who is here, provided his support all along to the team in terms of his rich insights. I hope that this report will be useful to the policymakers even now, although it pertains to only the first wave, and in similar situations when it takes place, in formulation of a strategy for improving livelihoods and ensuring better access to education and health. With these words, once again, I thank all of you who have joined this launch event. Thank you very much.
Thank you, Professor Sharma. Dr. Yasmin Ali Haq is UNICEF representative to India. Dr. Haq's leadership and professional experience spans over a wide range of fields, including public policy analysis, strategic planning for women's and child rights, child-centric development programming, and large-scale responses for children in a humanitarian crisis. It is my pleasure to give her introductory remarks.
Thank you so much, Priyanka and Professor Sharma for really the introductory remarks. I am really happy that we are finally launching the report that took assessment to a different level at a time when we were facing a crisis due to the COVID-19 pandemic. And how do we reach the socioeconomically vulnerable population through community-based monitoring? And for me, it has really been a journey that has helped us really reflect on how we reach people, especially those who are most vulnerable. Now, we all know how the pandemic has exacerbated and added a new dimension to the vulnerability in the lives of children. While the virus itself was not affecting children directly as much as it was affecting adults, it has altered the lives of children, especially those who are the most marginalized. Now, while it can be difficult to gauge what the full impact and what the implications and how the aftermath of the pandemic will shape lives, it has exposed some fragilities. And really, as Professor Sharma said, what we saw in the first wave and how we adapted in the second wave, it really shows the importance of reaching out to those who are impacted the most. The findings, as what we share with you today, will reveal how children are impacted in many profound ways, and how the hardships do get compounded because of the situation their families face, their parents face, or their caregivers face. At UNICEF, evidence is crucial to how we program and how we are informed in what situation the children are facing, and really to support us in being better at partnering with government, with civil society organizations, with academic institutions, so that we are working on the basis of evidence. We know that during the pandemic, many regular data gathering initiatives, manual MIS had to be suspended because of COVID preventive protocols. And we were struggling with how do we still find safe and creative ways of gathering data and evidence for rapid assessment, not to make judgments, but really to get a sense of the pulse of how children and their families are being impacted, and to see how vulnerable families have been coping when they face the crisis. So as part of the UN response to the pandemic, community-based monitoring was undertaken in 12 districts in 7 states to really study what the effects were being found and how we can address them. And as Professor Sharma mentioned, the data was collected in 4 rounds between May and December of 2020. Now, the findings captured evidence on the evolving impact. It was not static, it was very dynamic, and even between rounds, we saw differences taking shape. We were able to reach marginalized families, including pregnant and lactating women, economic migrants who were returning to their home states, and we were able to gather the voice of marginalized families on issues covering livelihoods, access to essential goods and basic health services, nutrition services, their awareness about the health and hygiene issues, about vaccine hesitancy, the negative coping mechanisms such as child marriage or violence against adolescents, and the receipt and access to direct beneficiary transfers or direct benefit transfers, and the services, the amazing amount of social protection schemes that were announced for those who are most vulnerable. So the report we are sharing today presents a summary of the evidence that we used in our discussions at the state level, that we used to adapt the programming that we were supporting, the messaging that we have been working on, so that we can get the best possible way of convincing even the most vulnerable and marginalized on the need for COVID appropriate behavior, for the need of vaccination, and the various measures that they can access. Now, we have seen really the amazing support of our partners, civil society organizations, 13 civil society organizations, and their 300 community volunteers across the 7 states. And without their invaluable support and that of the Institute of Human Development, we would not be able to get this finger on the pulse of the situation. Some interesting time trends have indicated, again, an evolving situation and gradual recovery. At a time when we are still battling with the pandemic, with its waning second wave, the findings are also useful for us to get a snapshot of what the costs have been to those who are most vulnerable, and the challenges they face during lockdown, after lockdown, and especially focusing on the urban slum dwellers and some of the more marginalized rural habitations. I know my colleagues are going to talk about the findings in some detail. I'd just like to highlight a few points that marginalized families across India in both rural and urban areas suffered as a consequence of the measures to contain the virus. But it did have a more severe effect in urban areas compared to rural, especially also on the availability of social services. We found the awareness and access to major social protection schemes was significantly lower. Most families experienced a decline in wages and persisting lower income, especially in rural areas. On a positive note, we also saw the availability of health services for pregnant women improving between July to December. Still, we know that about a third of the women who were aware received the maternity benefits that are available under the Government of India scheme. It's also encouraging to note that government institutions such as hospitals and Anganwadi centers gradually became more functional, and the outreach had been better in rural areas as compared to some of the urban slum areas. The study concurs with various other assessments around the country and the globe that really confirm what a disastrous effect the pandemic has had when it comes in terms of education and learning, with school closures and the digital divide exposing the fault lines and inequities. Some of the child protection issues have also continued to worry us all. That during the last phase of the data collection, December 2020, we found that 33% of mothers of 6 to 19-year-old children said that they had either heard of or seen cases of violence in their habitation. We saw that 35% of the main earning members reported the hours of engagement in domestic chores by children had increased compared to pre-COVID pandemic. So there are findings that we will need to continue to keep a finger on the pulse of, to look at what solutions can be available and to support the evidence being used more. The community-based monitoring has also proved to be an essential tool for rapid assessment during an acute crisis, so that we can be more agile in our programmatic response, as well as supporting policy decisions to reduce not just the current, but also future shocks when we see widened inequalities. The findings of this study have been shared with the Government of India, including with Niti Aayog and members of Parliament, as well as shared with concerned ministries. We have seen interest in expanding the mechanism, indicating also the usefulness of not just lie in collecting specific evidence, but also as a demonstration to triangulate, as a mechanism for triangulating information when we need rapid data when we're in a crisis situation. So just as the reality of the COVID-19 pandemic continues to emerge, so too will our questions and our analysis of children's deprivations, and really all of us working together to assure that the rights of children are being protected. I sincerely hope that the report and the tool itself will help many people here. Definitely for UNICEF, it will support us of our work moving forward. And I really look ahead today to hear from our panel, who will deliberate on the impact of the pandemic on vulnerable women and children and what they see as the utility of this mechanism. So with that, I'd like to thank you and really appreciate your joining us today.
Thank you so much, Dr. Haq. The UN Resident Coordinator in India, Ms. Deirdre Boyd, has over 30 years of experience within the UN system, working across a range of sustainable development issues. It is indeed my honor now to invite her to deliver her address in this virtual event.
Thank you, and good afternoon to everyone, and thank you all for joining us. First of all, I'd like to congratulate UNICEF and the Institute for Human Development for bringing out this very timely analysis of citizen data as the bedrock of crisis response. A crisis which, as Professor Sharma outlined very clearly, was unprecedented in the challenges it posed. Now, at the UN World Data Forum, which was held earlier this month in Switzerland, the UN Secretary General reminded us that we should not only ensure that data empowers individuals and communities, but also that it protects them when they are most at risk. As India confronted the pandemic, it was the granular information generated from communities on the impact of COVID-19 which helped public policy, helped health providers and the social sector to really hit the ground running with their response. UN agencies also relied on community-based mechanisms to make our response more effective during the most difficult waves of the pandemic. Community-based monitoring programs to monitor uptake of social protection benefits. We conducted rapid assessments on the socioeconomic impact of COVID on the most vulnerable and marginalized groups. Because community-based monitoring is not just quick and relevant data, it really can offer an anchor for healthy democracy, because it allows us to hear the voices of those who are often unheard. It amplifies the voices of the most vulnerable during times of crisis. So UNICEF's work, for example, with Angawadi workers, helped reveal the impact of COVID on children and allowed the quick provision of what was needed for immediate needs in hand washing, continuity of learning. Community-based monitoring also complements official statistics because it captures the intersections of real life. For example, official statistics can tell us the impact of COVID on women in the informal sector, can tell us the impact on persons with disabilities separately and long after the fact. But community-based data can give us clues today about, for example, what has happened to women with disabilities who've lost work and whether they were able to access healthcare easily. So we can course correct actions today rather than looking back in the future. And lastly, community-based monitoring empowers individuals as owners of development. Being counted is critical, but being heard is what makes all the difference. It's one thing to observe business closures, but to talk to someone who has lost her livelihood about what she needs, the aid and policy measures that she needs. This is something that supports accountability, supports inclusion, and supports democracy. So basically, it's all about more listening, more participation, and more consultation. And this is what will help the recovery from the COVID pandemic and indeed further SDG progress in India. So I think we all look forward to hearing more about the outcomes of this important report and working with you all to take these important lessons forward into India's inclusive path to recovery. Thank you.
Thank you so much, Ms. Boyd. This has pretty much set tone and temper of the discussions that will follow. I now invite Mr. K.D. Maiti. He is Monitoring and Evaluation Specialist at UNICEF. He headed the community-based monitoring exercise and was closely involved in the preparation of the report to present the highlights. Mr. Maiti?
Can you hear me?
Yeah, we can hear.
Very well, sir.
Okay, thank you so much. So my job is lightened quite a bit by my predecessors who have spoken here on the CBM and its utility. What I intend to give to this forum is the background and how this study was designed in a very brief manner. Now, this study on measuring the effect of COVID-19 pandemic on the marginalized families is it reference to the wave one of the pandemic, that is in 2020. It was conceptualized sometime in the month of April 2020, when the COVID-19 was declared a notified disaster by the government. Immediately, protective measures were rolled in by the government, taking several steps like lockdowns, closures of work establishments, quarantine of people, and restricted movements. And that created not only fear among the people, but also brought challenges in the lives of the people and their livelihood. News around the closure of the workplaces resulted in the rural areas as also in the urban areas. That got a kind of, and especially those who were on non-fixed or a non-regular income was seeping in, and the only source of information was through newspapers and the electronic media. We saw devastating visuals of the marginalized families with their women and children struggling to return home. So it was clear at that point in time who is facing the big brunt of the impact of the pandemic and how it is making the marginalized families more vulnerable than it was earlier in the pre-pandemic time. The children, the adolescents, the mother, pregnant women, and the lactating mothers in the marginalized families were found to be most affected severely, either directly or indirectly. In addition, it was evident that pandemic effect is not short-term, as it was evolving almost on a weekly basis. And at that point in time, nobody could predict what is the crest and the trough of the wave of this infection. And then the government announced a slew of welfare measures. It was a matter of concern to all, including us in the UN agencies, about the extent of socio-economic impact of the disruptive pandemic on the marginalized population groups who were already multidimensionally distressed. Most data systems that were usually available to the public were not throwing any quantitative indication, except, of course, the extent of spread of the infection in the country. It is with this background the study was designed. The critical components of the study design are that it has to be a monitoring mechanism. We can't do a survey as there are restrictions of collecting data, going to the field and do a face-to-face interview. And that has to be with support from community volunteers. And that led to our partnering with the civil society organization to capture voices from the marginalized families in these selected communities. The second dimension was that it should be a design which will allow us to capture the changes over time in a what we call in a longitudinal design. And third, most important, the information from the rapid assessment should be analyzed quickly and shared with the concerned authorities for program changes and develop evidence-based communication strategies. And we succeeded in that to protect people from the pandemic. Led by the UN resident coordinator and with the support of other UN agencies, it was decided to undertake this study. The study covered marginalized families in 12 districts in 7 states, has already been mentioned here. The selection of the geographies were largely around 3 critical points. One, that region which is mostly affected by coronavirus, as it was being reported by the government, Ministry of Health and Family Welfare. Second, the concentration of the informal sector workers, because they're the one who are suffering, they're the one who was losing the job, the family's income was going down. And third is where we have the large concentration of home returnees. So with this kind of a critical, geographies, the criticality of this study was the partnership, as Yasmin mentioned, partnership with 13 civil society organizations and its network of 300 community volunteers. And this entire process of community participation was led by Vadana Todo Abhiyan and the Center for Social Equity and Inclusion. We have the team from this in this gathering. The community volunteers were largely female volunteers because we wanted to talk to the women in the family. So it was designed in a manner that we have most of these community volunteers are female, so that we can have and develop a good, kind of information gathering from the such members who are really affected. We used some new technology. We have, Rapid Pro applications, and we use that application on a mobile platform to collect that information. Now, I don't intend to go into the results because my co-researcher, Professor Tanuka Endo from the Institute of Human Development will be presenting a few headline results. But to conclude, I would like to mention here that the COVID pandemic has made us learn several things, and its devastating effect also has affected large populations. So quite clearly, one of the lessons that we have learned is that the service delivery system of the social services of the government may need enhanced shock responsiveness. On the measurement side, the information emanating from different domains could be better used if it is integrated, and the focus needed to be rapid assessment. We can't be waiting for the entire year for a survey to be completed and know something which has already been over. That event will be known if you are able to capture that situation, if not real, but near real-time basis. So that are two critical components. And having said that, I do believe strongly that the community-based platform would be the need of the hour, given the kind of disaster that we are seeing on a regular basis, climatic as well as health hazards. There has to be some kind of a standard platform which would help and facilitate to collect that information in the most rapid manner. And lastly, community-based monitoring mechanism to assess the situation of families is not a new concept. Only thing is that the planners and the implementers have to have enhanced trust on such mechanisms for planning as well as for quick assessments. We do know that such mechanisms have been used world over in their own context, as it serves a good feedback loop to the program monitoring systems. And I must end here by saying that we have several data gaps or evidence gaps in our programming. So this can serve and probably bridge quite a bit of evidence gaps, and especially when we have very little information emanating from the village and panchayat level. So this kind of mechanism for bridging information or collating information from the lowest level of governance will be an useful tool. Thank you so much.
Thank you so much, Mr. Mathey. I now invite Professor Tanuka Endo, Professor at IHD, who led the IHD team in the preparation of the report, to make a presentation on the highlights of the report.
Thank you, Priyanka. I hope I'm audible. Just a very good afternoon to you all, respected panelists and attendees. Professor Sharma has already pointed out that the data here pertain to the first wave, and the data is really between May and December. So it really does not relate to the next wave, but it has very important lessons for all of us. Since we have limited time, I'll go straight into the presentation. I will request Priyanka to please share the screen, share the PPT on the screen. Yeah, you can start, please. Yeah. To the second slide, please. Second, yeah, thanks. So here we are covering some key issues, which I'll be listing out across. There are 4 phases of assessment in 12 districts, and we'll of course focus on children and women. So these sections are economic, including livelihood and access to food, social protection. Then we have health and nutrition. We also looked at COVID appropriate behavior and vaccine hesitancy, education, child protection and gender-based protection, and local governance. Next, please. Yeah, so as has already been discussed, following the lockdown, there was a rise in joblessness. A lot of people lost their livelihood. So in June-July phase of the assessment, we saw that the jobless share reached 26% in the urban sample communities and 20% in the rural areas. But by December, since we have traced it over a period of time, we saw that these dropped to 8 to 9%, which were the pre-pandemic levels, really. But the composition, the structure of the workers, of all the respondents, we found that the share of casual workers had increased, who are usually relatively lower paid compared to regular workers. And there was a decline in the share of regular employment. And in fact, the respondents also said that in December, they said the wages were lower compared to the pre-pandemic level wages. Okay. Next, please. So there was, in terms of food also, there were questions which were asked that to the main earners of the family, that do you have enough of food items like rice, wheat, pulse, edible oils, and so on, to meet your food requirement for the next week for all the family members. But even in December, we find that in urban areas, only 64% they said that they have enough. And in rural areas, higher percentage of 78% main earners said they have enough. At the same time, there was a difference in composition of this food consumption, because expenditure on nutritious food like protein-rich foods, with milks and eggs and fruits and so on, that actually was less than pre-pandemic levels as reported for October, November, and December. It was reported by 1/3 of the respondents. So clearly they were spending less on the protein-rich food, which is very much likely to have adversely impacted the children's development who need it more. Next, please. But the positive side was that the public distribution system and MG Narega, they provided real lifelines and support to people, because we find that there was a good access to the PDS ration card as reported by 88% rural and 76% of urban main earners in December. And in the rural areas, in October, November, 60%, and in December, 50% sample respondents, they sought this work, MGNREGS work, and 62% of those working under MGNREGS got timely wage payment, which was actually an improvement from October, November to December. Now, among all the households, what we identified were the home returnees, that is all the migrant workers who were working in urban areas, but with the lockdown, they faced the loss of livelihood and they all had to return home to their villages. So these families were definitely relatively more vulnerable compared to the average households, and so were the female-headed households. Usually, they showed higher proportion of joblessness, and they also had lower access to food availability in terms of this response, which I had spoken about earlier, vis-a-vis the average families. Now, among families who had children, we found that the home returnees, they reported more food scarcity vis-a-vis the resident families. I think there has been some discussion about the government schemes, access to government schemes. Awareness was better in rural communities, but both in rural and urban communities, the access was fairly low. Access to benefits was fairly low. Next, please. Coming to health, there was good access to treatment for COVID-19. Here, this is based on the responses of the community volunteers and for the period August-September. And as we have seen that urban communities were more affected by this COVID-19, but there was quite high awareness regarding where the COVID-19 testing centers are and so on. But for many, the testing facilities were quite far from their habitation. So that was a gap area. Next. Yeah. So next, there were rounds of questions about COVID-19 vaccine awareness also. Did they know about it? So we found fairly pretty high awareness about the COVID-19 vaccines, like in 80% in urban areas and 76% in rural earners. But respondents also preferred that elderly should receive it first ahead of others, followed by children. But the challenges were in terms of wearing a mask and maintaining social distance all the time. And what were the trusted source of information for COVID-19? Television topped everything and followed by radio and newspaper. Next, please. Now we come to some of the particular women respondents, like pregnant women were one of the major sets of respondents. So access to health and nutrition services for them, initially it was impacted. So June, July, it was dipped, but the access improved between August, September and December. And throughout June, July to December, around 90%, with a very high level of rural women, pregnant women, they reported that the local Anganwadi centers were providing the ICDS services. But this was situation was a little different in the urban areas because it dipped by the access dipped by 20 percentage points between June, July to December. Pregnant women exhibited, worse access to food availability because only 60% respondents were able to eat 3 main meals regularly. It was same in October, November, even in December. So not all got all the meals, all the 3 main meals regularly. Take-home ration, again, the access to take-home ration, which is a supplementary source of nutrition for pregnant women, lactating mothers, and so on. So that improved after June, July. As you can see, it had declined post the pandemic, but it improved after August, September. Rural access to THR was always higher than urban access. And child immunization responses were received from mothers of children less than 1 year old. And it was more adversely impacted in urban areas. In August, September, we see that 81% rural mothers and 71% urban mothers of less than 1 year old child reported immunization of their children. So things were picking up. Yeah. We coming to education. Yeah, that was a very, there was major disruption in this area, as we all know, because schools continued to be closed and online education proliferated. And that, of course, heightened the digital divide because many of the children could not attend classes. In October, November, the findings showed that 50% rural and 74% urban mothers of 6 to 19-year-olds children, they said that the schools were providing online classes and that mobiles were the main mode of disseminating education. Now, among those parents who reported that schools were providing online classes, 28% in rural and 11% in urban areas said that even though the school was providing online classes, the child was not attending. So why wasn't the child attending? One main reason, of course, was no access to smartphone, computer, laptop in the family. Internet connectivity was not good, and child had no digital skill. And rural respondents also mentioned some household work. So digital divide is really impacted these children, as we know, even was uniformly found to be better in urban areas, as we see. And but one very encouraging news was that in December, most parents were willing to send children to school once they reopened, because we see that it is reported by 95% of the rural 6 to 19-year-olds mothers and 81% urban mothers. But this was far lower in August, September. When we see those responses, it was 81% for rural mothers and 61% for urban mothers, who said that they would send their children back to school. So there was a great deal of improvement. Coming to child protection and gender protection, this assessment did not find a lot of evidence of child marriage. Only around 5% respondents, among the respondents who had daughters less than 18 years old, they said that since lockdown, their daughters had got married or they got engaged for marriage. But as already mentioned, there was rising violence was reported by community volunteers. Rising violence against women and children was reported by community volunteers, more in rural areas. It was actually also reported by 1/3 of the respondents of mothers of 6 to 19-year-old children in the December round of assessment. Now, among the main earners who reported that they had a 6 to 18-year-old child in their families as of December, more than 1/5 of the rural mothers and 16% of the urban respondents, they said that, sorry, not mothers, but main earners, they said that they had children who were either doing paid work or were looking for such work. So as we have already said right in the beginning, wages had been going down. In December, people had said their wages were less than the pre-pandemic level. So probably families were pushing their children out to work. And 1/3 of such children were 6 to 14 years old. And child engagement in paid work was found to be, engagement or looking for paid work was higher in the female-headed families. Now, panchayats played a very active role because they have this absolute ground level connection, and they promoted COVID appropriate behavior. They helped in THR distribution and a lot of other things. Some of the points we are flagging here, which are use of masks and social distancing, improving sanitation via cleaning of drains and sewerage, facilitation of the MG-NREGA job provision and wage payment, as well as food distribution and financial assistance to poor families. Now we come to the last two slides saying, to conclude, we can definitely say there were huge social and economic costs for vulnerable communities and for children post-lockdown. But PDS and MG-NREGA definitely helped the poor communities to face the challenges. And access to health sector services also improved after June, July. And however, there was low access to most major schemes for sample communities. So basically, there was a lot of resilience from not only people, but from government interventions, which helped the people find their feet. But of course, we found that the rural access to services were better than the urban areas. So we feel that some of the pointers for the future plug the gaps. We can say that definite livelihood options, as we have already seen, it is a persistent problem. Wages are lower, so we need better livelihood options and more via skill training. And for MG-NREGA, we have seen that some people wanted to access, but they could not get the job cards. There were other bottlenecks, so those should be ironed out. Ration cards provision should be expanded to kind of cover the remaining people. Address food insecurity among pregnant women. This was a very important area by targeted PDS maybe, that is one option. And improve THR access among lactating mothers and mothers of children, small children. Strengthening social protection schemes, which I think Mr. Maite has already talked about, such that these can respond to the extraneous shocks, because COVID-19 pandemic is one, who knows what will come in the future. So our social protection schemes, the system should be definitely be strengthened, as should be the institutions also, because that is the vulnerable communities need such protection, and they are the ones who are worst hit in such crisis times. Next, please. Media, it was found that TV has a widest reach, so definitely that should be used to increase the awareness about the need for social distancing and masks. In slums, as we all know, social distancing is pretty much impossible. So we should focus on use of masks. And we found that the female-headed households were very vulnerable then, and the pregnant women, lactating mothers, and children need special focus in implementation of social protection schemes. Some kind of targeting should be done. And in education, internet connection should be expanded, smart devices access should be expanded for the vulnerable children, certainly. But also we must remember there's a lot of poor digital literacy, not only for the children, but for their family members. So we need a medium-term solution. And reopening of schools may act as a preventive factor for child workers, but we also need effective government oversight for tackling this issue. So that brings me to the end of my presentation. Thank you very much. Thank you.
Thank you so much, Professor Endo. It is now time to launch the report. I would request Ms. Boyd to please allow me to play the launch video.
With pleasure. I'm delighted to see the launch of the report. Thank you.
Yes, so the launch of the report titled Assessing the Impact of COVID-19 Pandemic on the Socioeconomic Situation of Vulnerable Populations Through Community-Based Monitoring, brought out by UNICEF and IHD. And here it is. Congratulations to the team of UNICEF and Institute for Human Development who were involved in the preparation of this report. This report has 8 chapters, apart from chapters on introduction and design and methodology, as Professor Endo and Mr. Mehti just explained. It has chapters on major findings of economic conditions, health and nutrition, education, child protection, gender-based protection, findings on local governance, and of course, the conclusions and way forward. Congratulations to the team of IHD and UNICEF for the launch of the report. Thank you, Ms. Boyd, and thank you to the panelists. It is now time to start the panel discussion, which is on impact of COVID-19 on livelihoods of vulnerable populations, particularly women and children. This panel discussion is being moderated by Dr. Yasmeen Ali Haq. She's India country representative of UNICEF. I've already introduced her. The panelists in this session are Professor Mahendra Dev. He's Director and Vice Chancellor of Indira Gandhi Institute of Development Research, Mumbai. He's an eminent economist of this country with significant contributions in areas of poverty, human development, agricultural development, public policy. The second panelist is Dr. A.K. Shivkumar, well-known development economist who's contributed enormously to the areas of human development and public policy. And Dr. Uma Mahadevan Dasgupta, she is an IS officer of Karnataka cadre, currently serving as Principal Secretary in Rural Development in Panchayati Raj Department, Government of Karnataka. She has authored several articles and publications covering social, cultural, and arts discourses. She has deep passion for inclusive change, and the vote of thanks in this session will be proposed by Dr. Sriranjan. He's a retired IAS of 1985 batch. He's the Joint Director of Institute for Human Development. Apart from several positions in the government, he has been in charge of child development and nutrition as Joint Secretary for 5 years with the Ministry of Women and Child Development, Government of India. I would request the attendees to place their questions to the Q&A box and would now hand over the reins of this session to Dr. Yasmeen Ali Haq. Thank you.
Thank you so much, Priyanka. And really, it's my pleasure and honor to have Professor Dev, Shiv Kumar, and of course, Uma. Good to see you after a long time. So colleagues, we're going to hear from our panelists, and then we will also have the opportunity to pose questions. Definitely, please do keep posting your questions in the chat box, and we'll keep responding to them as much as possible. But let me just open it up to our panel now. So if I could really request Professor Dev to start with your comments, please.
Good afternoon. Thank you, Dr. Yasmeen. Thanks to UNICEF and IHD for inviting me for this important panel. So let me first congratulate the team for this excellent report. It's also innovative and novel way of collecting data through community-based monitoring involving civil society organizations and community volunteers, particularly females. So the report brings out the impact of the pandemic on the loss of livelihoods, health, education, food and nutrition. And it also showed, the urban areas were more vulnerable than rural areas. So in the next 10 minutes, I'll be focusing on two things, not on the report per se, but first, what are the lessons from the pandemic? And second, way forward, what are the policies needed for improving the socio-economic situation of vulnerable population, including women and children. So first on the lessons, as you know, the economic shock due to the pandemic is much more severe for India for two reasons. First, pre-COVID-19, the economy was already slowing down, compounding the existing problems of unemployment, malnutrition, and widespread inequality. Second, India's large informal sector is particularly vulnerable. As you know, 91% are informal workers in India. The pandemic has increased inequalities further and has K-shaped impact on the economy and livelihoods. Large part of the corporate sector could manage the pandemic with higher profits. The stock market has done well. On the other hand, vulnerable population, particularly the informal workers, including the daily wage laborers, migrants, MSMEs, etc., have suffered a lot with loss of incomes and employment. But regarding labor market, unemployment increased and labor force participation rates declined, particularly for women. So even after recovery now, there are about 10 million jobs or less than the pre-pandemic period, even now. The CMI shows that in the second wave in May 2021, around 93% of households reported a loss of income compared to a year ago. And also, according to Azim Premji University report, millions of people were pushed into poverty. On health, it is true that through the tireless efforts of frontline workers, doctors, nurses, sanitation workers, continuity of services are maintained, including vaccines, and contained the pandemic. On the other hand, the pandemic is also exposed India's weak health infrastructure in both rural and urban areas. So one lesson on health is the need for improvements in healthcare. And there was also neglect of non-COVID patients suffering from cancer and other health problems. Similarly, there are lessons on education, which were already mentioned. Another issue is food deprivation and malnutrition, including the pregnant women. A large number of people struggled to feed their families and food intake dipped. Children also did not get sufficient nutrition services, particularly in urban areas. And midday meals were also affected as schools were shut. And these are the lessons from the pandemic, which the report also mentioned. The central and state governments and RBI have responded using fiscal and monetary policies. It also includes food and cash transfers for the informal workers, including migrants. The relief measures helped the rural areas particularly, but they compensated only a part of income losses of the poor and informal workers. So next, second part of my presentation, what are the policies needed in the post-COVID world? So I have 5 points here. First, on macro policies. They are equally important because sometimes we forget macro policies. Macro policies like fiscal and monetary policies should focus more on social sector, employment, food and nutrition, and social protection measures. Basically, a move towards more welfare measures, if not welfare state. So widening of tax base and increase in some direct taxes, including wealth taxes, can raise the revenues and more allocations can be given to these sectors. Second, there is livelihood crisis in India. Unemployment, particularly youth unemployment, is very high. So there are 8 employment challenges in India. One is creating productive jobs for 7 to 8 million per year. Second, correcting the mismatch between demand and supply of labor. For example, only 2.3% of India's workforce has formal skill training compared to 96% in South Korea, 95% in Germany, in other countries. Third, improving the incomes and productivity of informal sector, which are about 91%. Fourth, the structural change challenge, manufacturing and services should create jobs. Fifth, focusing on MSME sector, which has a lot employment potential. Sixth, the getting ready for automation and technology revolution. And seventh, the social security and decent working conditions for all, including informal workers. One of the recently Nobel Prize economists also showed that rise in minimum wages may not increase unemployment. And lastly, in these livelihoods, focus on employment of women, which is declining. This is a serious issue. So these are the livelihood challenges, my second point. Third point is on social sector. First, in the short run, we have to take care of vaccines and pandemic, which may soon become endemic. COVID-19 has given us several lessons on health sector. Public expenditure on health is only 1.5% of GDP. The country has to move towards universal healthcare and spend 2 to 3% of GDP on health. And as mentioned earlier also, the great quality dichotomy exists both in health and education sectors. So there are islands of excellence, corporate hospitals and all, that can compete internationally, even in education, while vast majority of poor have poor learning achievements. So we also have the experience of digital gap in education during the pandemic. It has a long-term effect on education, particularly children from vulnerable population. So extra effort is needed to recover the 2 years loss in education. So one has to fix this dichotomy in health and education. Basically, we should move towards universal basic services for everyone. My fourth point is that, which is related to digital divide, is the exploitation of the poor people in financial matters. You might have seen the article of John Dress on Jharkhand, where a business correspondent from a bank cheated a poor woman of about rupees 25,000. So there is a need for digital awareness and skill improvement in order to avoid exploitation of poor women and other households. Civil society organizations or women's groups like Kudumbasri in Kerala can help them. Last point is on social protection. India has a long experience in these programs like MG Narega, public distribution system, nutrition programs like midday meal schemes and Anganwadi schemes, etc. People in rural areas have benefited partially, although you also need more in rural and urban areas. Malnutrition among children and women is still high in both rural and urban areas. Diversification of diet towards non-cereals like fruits, vegetables, livestock, and fish is important. Also, affordable diversification is needed. There are some gaps in the social protection programs. Some of the poor are excluded due to Aadhaar-enabled services. So this problem has to be tackled. The UNICEF-IHD report has also pointed out that on governance, Panchayat seems to have done well. The urban councils also have to improve their governance. The social protection programs have to be strengthened with more allocations. In India, there has been a lot of discussion on universal basic income. There is a consensus for cash transfers directly giving to farmers, women, old age population, etc. A kind of quasi-universal basic income. It is true that universal scheme is easy to implement. The issue with targeted programs is the problem of identification and exclusion. So to avoid this, in order to avoid the identification problem, Dr. Rangarajan and myself suggested 3 proposals to meet the objective of providing minimum basic income to poor and vulnerable groups in both rural and urban areas. So these are first, give cash transfers to all women in both rural and urban areas above the age of 20 years. And second, expand the number of days provided under MG Narega from 100 to 150 in rural areas. Third, launch the National Employment Guarantee Scheme in urban areas, including skill improvement, which can be slightly different from rural areas. So we have estimated how much it costs and all. In all these proposals, there is no problem of identification. A combination of cash transfer and an expanded employment guarantee scheme can provide minimum basic income for the vulnerable population. Right now, automation of fourth industrial revolution is not a serious problem in India, but over time, with increase in more tax revenues, India also can think of moving, have some universal basic income. So to conclude, in the short term, we still have to tackle the pandemic. The UNICEF-IHD report is very useful for framing appropriate policies. In the post-pandemic period, India has to learn lessons and move towards improving social sector by providing universal basic services, decent work for everyone, raising women's participation and their nutrition of women and children, and education of children. In other words, we have to move towards the principle of leave no one behind. Thank you very much.
Thank you so much, Professor Dev. You've really comprehensively covered a lot of the issues that the report brought back, and also re-emphasized in many ways a lot of the discussion around how social protection measures for the most vulnerable can be enhanced further. And in leaving no one behind, I think this is the time to have a shout out for Wada Na Toro Network, who really have been able to help us bring the voice of those who are likely to be left behind to the forefront. So a big thanks to the network. Let me now turn to Dr. Shiv Kumar. Shiv, over to you for your perspectives.
Thank you so much, Yasmin, and thanks to everyone for inviting me. I also want to begin by expressing my appreciation to UNICEF for commissioning and collaborating with IHD, Wada Na Toro Abhiyan, and the Center for Social Equity and Inclusion to carry out this survey at a very difficult time because of the COVID pandemic, but also at a very difficult period for many of these families that were encountering great hardships. So even to go and ask these people how they were feeling is just a really very difficult challenge for even the community volunteers who did so. Before I make any further comments, I also want to say that it's really fantastic to see such kind of collaboration of civil society organizations and networks of volunteers to carry out such surveys. I really think this should be the future of all kinds of collaborative research that the UN agencies and others who really want to get the pulse of the people, this is the way to go. I don't see any, what is fascinating is that the investigators and researchers did not have a commercial interest. They did not have an academic interest. Their goal is not to publish some paper in a refereed journal. But the investigators and researchers were genuinely interested in understanding the insecurities of people and the families and the plight. And I think what somebody mentioned about the democratization of evaluation, this is really the way forward. A small comment again, I think the title of the report, Assessing Impact, I think I've always had a little bit of a problem with the word impact. It's too big a word to use. At best, what the studies are documenting is the effects of lockdown on families and communities and so on and so forth. Because the impact of COVID is two types. One is, of course, the direct impact is if you do get COVID, then what happens to parents? And some of them have died, and so there are orphans and the conditions of orphanhood directly affecting children. But then a lot of the things that Mahinder Dev also flagged about impacts on nutrition, about violence at home, and so on, are at this moment the effects, and we really don't know how the even the intermediate, medium, and long-term impacts are going to be on children and adults as well. So I think that is just a qualifier, but I think that's not the spirit with which the report was called Final Impacts. I think Mahinder Dev has said so much that for an economist to follow and add much to it, to what Mahinder has said already is very little. I'm just going to flag a few, building on what he has said, 5 points also. I think economists seem to specialize in 5 points. I think 3 is too few and 8 is too many. So I guess we strike 5. The first is, again, like he said, that the outlook, the economic outlook is not very good. There's a lot of focus on the projections of growth. 7.5% is what the IMF has said for next year, and maybe 7% for the following year. And everyone seems to be very excited about it. But when you deconstruct these growth, we've always made the point that focusing on growth is inadequate to see how it translates into improvements in people's lives, or in this case, restoring the insecurities in people's lives. But some of the projections that I made, and when you convert it into per capita consumption, we know that the percentage public spending on health and education as a percentage of GDP has been stagnant. But if you were to convert this into per capita expenditures, real expenditures, you find that both on health and education, even by 2023-24, we would have been touching the levels that were there in 2019-2020. So we don't even know whether this growth is coming up and whether the resources are coming up, but we know that there is going to be a severe shortage of funds for the social sectors, which actually leads me to highlight one of the important features of the 15th Finance Commission that has been underscored, and I think we should all pick that up. They have said that, they have recommended that 10.3% of the total grants in aid over the 5 years should go to health. But they've also said that 2/3 of the total grants in aid for health should be ring-fenced for local governments for strengthening primary healthcare facilities. And I think that's an extraordinarily important feature. Even if the allocations don't go up, if there is some way we can all collectively advocate and put pressure on the state governments and the center to say that please ring-fence 2/3 of whatever allocations you're making for strengthening community health interventions, that would really make a big difference, because we really don't have control over the macro climate and growth and so on. Second, I think in terms of the effects of children, everyone has, Dr. Alak Sharma, Yasmin, Tanuka in her presentation have highlighted many things, but in terms of there are several new areas of concern that have come up. So even with limited budgets, we have to find creative ways of, even for an agency like UNICEF, how does it reallocate its limited resources over many new challenges? So it's not just the government of India, but for many agencies, it's nice to get a whole laundry list, but how do you prioritize? And I think all the UN agencies are looking ahead over the next 5 years to shape up their country's program. I just wanted to flag a few. I think universal health coverage must be a big platform that everybody comes together to champion. But included in that should be a very, very strong component of mental health, and mental health for children, because we just so narrowly focus on service delivery of physical services that we really don't worry much about mental health. I think that's one. I think the crisis in schooling is extremely serious, and I worry about this certification that's coming up, tuitions, private tuition companies like Byju's that are coming up. There might be a large school dropout with all that we hear about potentially a likelihood of increased child labor. And then there is this push for vocational education. But let's not forget that all the vocational education conversation is only for young boys. I have not heard of any serious program of helping out adolescent girls. So there is a real difference when people talk, economists talk about, education, employment, productivity, and growth. It's a very male-centric way of telling the story. The reality is most of the young women, not just in rural and marginalized communities, even in very good middle-class families, are discouraged from going to work. So we really have to worry about this, what is happening to girls and adolescent girls, and how the pressure of marriage and all that builds up and affects their mental health as well, including looking at issues of violence against children and so on. Lastly, I think we should not forget the impacts or the consequences of these lockdowns and COVID on women. And I think that's another very serious area. UNICEF does talk about women and children, the pressure of working at home. Many of them have dropped out of employment. They're sitting at home because there's no other, there's no way of coping with it. There are reports of increase in interpersonal violence and the mental stress that many women are going through, even in professional occupations, let alone in the formal sector, is something to be deeply concerned about. If people in the formal sector, women, are feeling so much stress, you can imagine how it must be for people in the informal sector. I think a third point which I'll make very quickly is that Mahinder, they've also spoke about universal healthcare, universal social protection, universal basic income. It really throws up the whole question of what is the role of the state and what are the obligations of the state vis-a-vis the guaranteeing of rights that are there in the Constitution of India. And I think that debate and discussion we are not having at all. When I see the increasing privatization of school education, I really want, when you hear that 50–60% of children are going to private schools, and by the way, the crisis in private schooling is so severe at this point of time. In fact, there are unions of private school teachers that are being formed to come and plead with some of the others saying, do something for us. They're all jobless. There are no private jobs for private school teachers at this point of time, however meager their salaries might be. So there's a real crisis in education, and we are not able to recapture the role of this importance of the role of the state in both health, in education, and in social protection. So this is an opportunity to open up a much bigger public debate and public discussion on this at a time when the mood seems to be for the government to divest many of the investments that they have, which some of it might be absolutely justified, but the question is, when you get the money, where are you going to put it in? And that's where my concern is. So if you're going to sell off some public sector loss-making enterprises, I will not object. Like they say, it's not government's business to be those businesses, perfectly fine. But please guarantee me that the money you get is put into the social sector. So we are not even having that conversation. There's blindly support or no support. So that's something which is worrying. The fourth point is, of course, the importance of strengthening community level actions. I think this is a very good example of how to involve the local communities in articulating what their concerns are, what their needs are, what their fears are, insecurities are, and developing local responses to it. I think we really have to shift the entire emphasis on how do agencies or how do groups, how do all of us work to strengthen community level responses, because by the time policy is changed and allocations are increased and it trickles down to, these announcements have very little meaning when you're really at the community level trying to see what it does to you. So I think we have to find new ways of approaching strengthening communities, and there I want to really say there is a crisis with the civil society organizations in terms of the constraints, not just the funding FCRA constraints, but also the freedoms they have, the local funding that they get, because many of their activities sort of are bordering on, you can call them political at any point of time. I think poverty eradication and serving the poor is a political activity. And anytime I can call the bluff and say, this is political, this is non-political. So many of them are very nervous at this point of time. And somehow all of us have to find some way of empowering community-based organizations to do very good work. Last point, my fifth point is that I think what the survey also reveals is the extraordinarily weak research, data collection, evidence gathering systems that we have in place. I don't think we needed a pandemic like this to tell us how little we know, what very weak tracking mechanisms we have to really find out what is happening to people's lives at the community level. New research methods have been thrown up. We need real data, so new methods like Maitei was saying and Dr. Alak Sharma was mentioning that the investigators have used different methods, but this cannot be one-off. How do we institutionalize this kind of data gathering, data tracking, especially at a time when finding out the truth itself is a challenge, and None of us researchers have ever relied on administrative statistics. Dr. Sriranjan also knows that. We always rely on survey data only, however good or bad that might be. But we are really challenged today as researchers to say that the dependence and reliance on administrative data is very weak at this point of time. So the importance of having many more, I would urge UNICEF and other agencies to say, yes, you did that in phase 1, but why not plan a whole series of a long term, let's say 3 years, then you can talk about the impacts of what happened during the lockdown over 1 year, 2 years, and 3 years. So some kind of a longitudinal study to track some of these families would be absolutely important and vital. So let me stop here. And once again, congratulations to UNICEF, IHD, Vadana Todo, and Center for Equity and Inclusion. Thank you.
Thank you so much, Shiv. And indeed, another call out for the Center for Social Equity and Inclusion. And I think for me, personally, one of the most exciting parts of this has been the fact that we have addressed the COVID concerns in data gathering, and we have managed to reach the most marginalized in ways that the exclusion criteria, as much as possible, we've been able to address. So let's now turn to Uma Mahashgupta. Uma, looking forward to your perspective.
Thank you, Yasmin, and congratulations again to IHD and UNICEF and all the other organizations who were involved in bringing out this very important report. I'm fascinated by the word community, and I'd like to unpack it and expand it a little bit. In my current role, I'm Principal Secretary for Panchayat Raj. I also am looking after Women and Child Development Department. I'd like to talk a little bit about what the Gram Panchayats in rural Karnataka have done during the pandemic and what that might suggest for the way forward, at least in Karnataka, not only after the pandemic, but also to address other difficult problems. I think the first thing about the panchayats, I really am talking about the rural response, the COVID rural response. And I'll talk a little bit about first wave and second wave. The interesting thing is that COVID and the pandemic, the lockdown, brought out the capacity of local governments, of Gram Panchayats, to function no longer as just arms of the state government or agencies of the state government, but as local governments on their own. And what I mean by that is that once there was a lockdown, March 24th, end of March, there was the lockdown, and State Department officials could not go to rural Karnataka, could not go to the panchayat areas as they could earlier, and governance was a vacuum, and so local governments had to step up, and indeed they did. We have 6,000 Gram Panchayats in Karnataka, and what we did from the State Department was to immediately issue an enabling order, setting up what are called Gram Panchayat task forces, which brought together the elected representatives. There are 90,000 plus elected representatives in Karnataka. 50% of those are women. So we set up Gram Panchayat task forces in each panchayat. There'd be a task force comprising of elected representatives. The Gram Panchayat staff, we have around 80,000 staff, frontline workers, Asha workers, Anganwadi workers, also the revenue, village accountant, revenue inspector, the local police constable or the sub-inspector, the village rehabilitation worker who works with the person with disabilities, even the bank manager, if there's a local branch of the bank, or the banking business correspondent, and volunteers, very importantly, volunteers from the local community. Set this up, and immediately the second big discovery that we made was of YouTube being a very viable and very effective way to train at scale. I think our first YouTube training for 6,000 panchayats happened on 25th March. 24th, we issued the circular. 25th March last year, we conducted a statewide YouTube live training, and we had just communicated the day previously that they should be in front of their computers at 11 o'clock for the training. They were there at 10:45. So there was a huge groundswell of response and willingness to step up. And this was exciting because panchayats took the lead in, first of all, science-based awareness. This was important because the lockdown came simultaneously with the Ugadi festival in Karnataka, which is when a lot of people went from urban Karnataka into rural Karnataka for the festival. This could have been a time when, without science-based information, there could have been misinformation, there could have been panic, there could have also been chances of not following social distancing, physical distancing, especially lockdown or no lockdown, rural life has to continue. And the milk cooperative every morning at 6 o'clock, the PDS shop, the water purification plant, everywhere, people need to follow physical distancing. And so science-based awareness about the virus, about ways to protect. This was March 2020. The second thing that Gram Panchayats did was to perform effective COVID management to the best of their abilities. This included tracking people with travel history, people who were returning to the villages, people who needed to be quarantined. 11,000 institutional quarantines were set up and managed during this period in government schools and residential hostels. Overnight, these were transformed into quarantine centers. This was the first wave. Going forward, Gram Panchayat stepped up for testing, both antigen testing as well as RT-PCR. In the second wave, Gram Panchayats not only managed quarantines, but also managed COVID care centers, isolation centers, and for the very first time in Karnataka at least, disaster relief fund was released directly to Gram Panchayats. Over 30 crores was released directly. Thereafter, the Gram Panchayats have been managing vaccination very effectively, vaccination of special categories, especially like persons with disabilities, senior citizens, vaccination on site at MG and Rega work sites, and so on. The third important role that they performed was of relief. And this is very, very important to me because it gave me a window into the ways in which panchayats can perform their role of being not what we call the last mile, but actually what I call the first mile, because governance actually has to start with caring for the vulnerable among people. And it just takes too long for a program to reach all the way up and then down again. The Gram Panchayats have untied funds, they have convergent task forces, and they need to reach their vulnerable populations immediately. So this also included taking care of the needs of migrant workers. It included community kitchens and shelters. It also included arranging for banking business correspondents to come to the village and allow people to either withdraw money or to deposit money, depending on what their needs were during the lockdown. It included helping people with social security pensions if they hadn't got it during the lockdown. Included meal supplementation, supervision of the delivery, doorstep delivery of Anganwadi rations and midday meal rations. Included continuously, even through the lockdown, with precautions, continuing with MG and Rega work with precautions, including the issue of job cards to returning migrants. So this was very important. Thereafter, between the first wave and the second wave, when there was a lull in the number of cases and in the positivity rate, panchayats in Karnataka also stepped up to help rural children stay connected to reading by restoring and reviving their libraries, 5,600 rural libraries, turning them into learning spaces, enrolling about 1 million children as library members, and a child survey, because we were aware that children would be left out of school or Anganwadis or not be getting the rations or not be registered. And therefore, a child survey of 80 lakh households was also conducted in rural Karnataka by panchayats, along with self-help group members. Why do I say the task force is important? Because the task force is not just a body which meets and reviews, but it also is a platform for convergent action using the untied funds of the panchayat. So going forward, what can we do? Karnataka has already looked at how the Gram Panchayat COVID task force can become an effective public health task force, whether it's for tuberculosis or for domestic violence, violence against women, and so on. We've set up a Gram Panchayat education task force to help students stay connected with learning and to start taking a deeper interest in what students will need, what support they will need while getting back into school. Maybe it's mental health support, maybe it's some kind of additional classes during holidays. Gram Panchayats in 13 districts, that's 2,800 panchayats in Karnataka, have also started a campaign called the Gram Panchayat Arog Amrit, which is a program to monitor NCDs, non-communicable diseases, especially blood pressure and diabetes, at MGNREGA work sites, for which we've partnered with KHPT, and USAID has helped us with some funding. Anemia, blood pressure, diabetes, and malnutrition will be tracked in rural populations who are largely the rural landless and MGNREGA workers. Another big discovery of the role of panchayats has been that after we had elections last year in December 2020, which were highly contested because very energetically contested, I think partly because of the work that panchayats did during the pandemic, we discovered that we can now look at hybrid modes of training for Gram Panchayats, which will again improve their capacities. Since 1993, we've all been talking, those of us who are committed to decentralization have all been talking about the need to build capacities. Well, here is a way in which we have built the capacities of 88,000 newly elected members in 300 taluk level training centers with a hybrid mode without residential training. And there was 97 to 98% attendance. More women attended than even the men, which was very, very heartwarming and encouraging for us. This training was conducted as a combination of videos, group activity, role plays, and a daily YouTube live session at the end of the day to debrief and answer questions. This is important because panchayats, I think, have to play a greater role, not only during further pandemics or during further public health emergencies, but also in the people, not only during disasters, but in day-to-day intractable problems like malnutrition, like the education crisis in rural India, and so on. As part of this, panchayats this year are getting ready to do gender and child budgeting for the first time, along with perspective planning. We're also getting them to make a disability budget. I think this gives a lot of scope for research on decentralization to look at the way forward. One of the questions it raises is whether institutional design for urban local bodies is strong enough, or whether this needs further scrutiny and discussion. Certainly, it also points to the opportunity to devolve more and more functions and services to rural local bodies. And also the potential for rural local bodies. There are 2.6 lakh rural Gram Panchayats in India. Can play a great role in rapid response in disaster situations, in climate, health, nutrition, emergencies, and also to address the problem of exclusion in social welfare services. Two last points based on the questions that I saw in the chat box. One was about child marriages. In Karnataka, we have amended the act, as you know, Yasmin, the Child Marriage Act, to make what is voidable actually void ab initio. This was in 2007. At the time of NFHS 3, it's gone down since then to something like 20%. However, reporting has increased, awareness has increased. Even despite these, nevertheless, there has been an increase in the number of child marriages that have actually happened, not only in Karnataka, but in many states, due to the issues, the potential for simple marriages, saral vivaha, as they call it, during the pandemic. Also because of the impact of school closures, but I think also because rural communities have had this fear of the unknown during the pandemic. It's not just a functional reason. It's not just a reason to, grab a chance and get their daughters married, but also this great anxiety about the pandemic. And I think that brings us, I think one of the other panelists also spoke about the perhaps unaddressed mental health issues that stay with us and trauma that stays with us after the pandemic that really needs to be unpacked in coming months, and how rural communities can be supported through this. That's pretty much all I had to say at this point. Thank you.
Thank you so much, Umaji, and really thank you for already addressing one of the questions that keeps coming up. And our audience also is interested to find the report of the survey that you did. So if you can post the link, if that is available, people are quite interested to learn of the findings of the survey that was conducted. I know as always, we're running tight on time, so I'm just going to look at a couple of questions. We do have a very specific question to you, Professor Dev. I don't know if you have seen it. Or no, actually, there's a question to Professor Ravi Srivastava, and maybe we take the opportunity to hear from him, what factors does he see play for the highest growth of share market when every social and economic sector is on a downward movement? So maybe Professor Srivastava, you could give us a bit of insight to that. You're muted, if you could unmute.
Well, share markets are not the only sector of the economy that is booming just now. Because the formal sector profits are also booming. And what we are seeing is very asymmetrical growth, as Professor Mahendra correctly pointed out a little while ago. The pandemic has hit some sections, the vulnerable sections, very, very hard. But I think we need to put policies in place which protect the vulnerable sections much better than they have. And they should have started, our policies have to be oriented towards this even before the pandemic. And certainly the pandemic has told us that we can't leave our unprotected sections, our vulnerable sections, as unprotected they are. And the UN has consistently pointed out the dangers of rising inequality, global inequality, the unsustainable costs of inequality, both at the national level and at the global level. The pandemic has again given us pointers towards that. So it's not only the stock markets which are actually pointing towards that. A lot of other indicators are telling us the same story.
Thank you so much, and thank you for taking that question. Professor Dey, any thoughts from you on any of the questions or issues that our audience have raised?
I mean, on the stock market, basically, in most of the countries, the liquidity is available. Because of they are having loose monetary policies and fiscal policies and things. So a lot of money is coming into the stock market, both domestic as well as the international market. So whereas the impact on women, children, and all is very adverse, whereas corporate and stock market. That's why there is a widening inequalities in both first wave and the second wave there. But also, as mentioned by Shiv and Ms. Dasgupta on the the local government, and also Shiv mentioned 15th Finance Commission. Even the 14th Finance Commission also, Dr. Y.V. Reddy, they also mentioned, but I don't know how much they were given to the panchayats thing. But I am hopeful. I think, as Ms. Dasgupta also mentioned, these panchayats, particularly women panchayats, I also have done some work on that, which are doing much better than the male-dominated panchayats. So that is one way of going to rural areas. But as the UNICEF-IHD report mentioned, the urban areas a lot of gap, which the pandemic has brought out. I think there we have to have something for not only unskilled workers as well as skilled workers. What are the things needed for urban workers? For example, in Bombay, I've seen a lot of people have suffered, the migrants and others because of this. So, and other problems, of course, as Shiv and others mentioned, the mental health problems and all are going to be crucial. And education, of course, is the.
Thanks, Professor Shiv. Any final words from your side?
Thanks. Yasmin, I also wanted to point out that our understanding of urban community action is quite limited compared to rural community action. So the report really points out that the urban crisis is much higher. And when you have so many migrant workers coming in from the villages to work in these cities, what exactly is the community we are talking about? How do you get to them? Whom are you going to influence? So I think there's a lot to learn from how to organize. And I think Ms. Uma Mahadevan also mentioned about panchayats, and I think there is some, what should I say, muscle power and dum when you talk about a panchayat, but it's not so in the city. So I really wonder what the next steps would be if you're looking at urban community action.
Thanks a lot, Shiv. Umaji, anything final from you? I know you've answered a lot of the questions that came up.
Yeah, I just wanted to add a couple of things. One was, of course, that, carrying on from where Shiv had talked about urban communities, urban slums really need representation. Yeah. And that is a matter of institutional design in the implementation of the 74th Amendment. So that's where we really need to start talking about how to improve representation. Informal ways of representation are just not going to be enough in this kind of situation. So this is one. The second thing is I wanted to also mention that in rural areas, self-help groups play an important part of what, defining what a community is. And panchayats, along with self-help groups, can partner very effectively and can also be a check on each other, an accountability mechanism. Brings in women's participation in a bigger way. And through women's participation, it also throws light on issues of health, nutrition, gender inequalities, and so on.
Thanks a lot. So I know there are more questions on the chat, and I'm afraid we don't have time for it today, but it's important that we get your perspectives on these issues. We've heard from our panel their perspectives, their reactions to what's in the report, and also they've enriched it with their own experience, their own sense of what can be done further, and very importantly, looking at how the community connect can be made stronger. I definitely agree that one of the most vibrant groups I've had the opportunity to meet in India have been the women's self-help groups, no matter where in the country I've been. The Kudumbashri that Professor Dev talked about, amazing network of women who really are there for each other in so many ways. There is still a way to go. The solutions that we've seen in the second wave, and now as we deal with the effects of the two waves and prepare or anticipate how the pandemic is going to move in the coming months, I think what remains quite clear is that we do have to keep our focus on the most marginalized. We do have to keep our focus on better ways of reaching them, of bringing their voice to the forefront, and to quickly respond to it so that they have access to a lot of the very good schemes that are available to the most disadvantaged. So with that, let me hand back to Priyanka, and a big thanks to all our panelists for joining us.
Thank you so much. I now invite Dr. Sriranjan, Joint Director at IHD, to propose the vote of thanks.
Thank you, Priyanka. Distinguished panelists, speakers, and friends. In fact, this report, as everybody has mentioned, brings the emergent dynamics of socioeconomic situation and vulnerabilities in the most disruptive phase in recent history of humankind. It also brings to the fore the suddenness, the sullenness, and the poignance to the fore. responses, which continues to pose enormous challenges, have exacerbated difficulties, disrupted lives and livelihoods, and left scant space and opportunities for individuals and households, and indeed for humanity to maneuver, which was and still is somewhat floundering. The multidimensional hue of issues involved, as the panelists and the presenters have brought out in this research, this community-based monitoring has brought out. It has brought out multidimensional, multi-sectoral, multifactorial responses in which caring and comforting governments and society must lend all possible solace and succor. Indeed, concerted efforts from the governments and civil society, and above all, the tireless work by frontline workers involved in managing responses and maintaining the continuity of essential services have been laudable. Needless to say that various programs, particularly community-based programs, PRIs, the role of PRIs, PDS, the Garib Kalyan Yojana, the MG Narega, Kisan Samman Nidhi, etc., have been some kind of fortitude and have given lifeline to the vulnerable. But we know that there are challenges, there are gaps. I cannot but hold myself, I cannot hold myself in pointing out that the take-home ration in the ICDS should have been the mostly available in fortified and enriched form right from beginning. But in fact, Anganwadi services and the children were made most vulnerable, and wherever the rations were given in kind went to the common pool of the family rather than nutritious and available to the children. So we need to see whether systems and systemic weaknesses on child development have been laid bare, and why and what factors are responsible for this, and what kind of responses we need to bring. The panelists, eminent panelists, they have brought out several key issues, and one of them is, I need to point out, is the child survey which Karnataka has done. We did rapid survey on children, UNICEF, with the UNICEF support, and MWCD had initiated it in 2013, and yet many aspects of that survey has remained subdued or subterranean. So we need to bring these aspects to the fore, learn lessons as has emerged, and take these experiences and lessons from the first phase as captured in this report and as brought out by panelists, particularly the Karnataka, Ms. Mrs. Umar Mahadevan, has brought out several aspects and challenging aspects, and it's heartening that she is leading also the woman and child, where community programs are strengthened. The Karnataka has historically PRI, strong PRI, but there are layers. We know India is subcontinent size. One kind of solutions or recipe cannot survive in other areas. Lastly, community-based monitoring and the multitude of community organizations, 12 or 13, with 300 volunteers, is also a good CBM. Could be confidence and capability building measures, have brought actually confidence and capability building measures. And of course, we need concern-based mobilization and mitigation, which is another CBM I would like to bring. It's time now to express our gratitude for this endeavor, particularly this whole exercise of collecting data, collating it, analyzing it, and bringing to the fore. Today is the culmination. We are grateful to Dr. Yasmin Ali Haq, UNICEF country representative, for her all-round leadership and direction in general, and during this crisis, and this study in particular. This dissemination of results is testimony of a resolve and seriousness in approach towards learning and sharing for caring. We are grateful to very illustrious and eminent panelists, Professor A.K. Shivkumar, Professor S. Mahendra Dev, Ms. Uma Mahadevan Das Gupta, Dr. Yasmin Ali was once the coordinator and the moderator, Dr. Tanka Endo, Mr. K.D. Mighty. They all have brought out today's dissemination for their insightful wisdom, flagging issues, and envisioning strategic responses as a way ahead. We are very grateful to Ms. Boyd, UN Resident Representative in India, for finding time to be in this event and sharing her thoughts and to benefit us by her insight and wisdom. The UNICEF team comprising Ms. Misaki Akasaka Ueda, Mr. K.D. Maiti, Antara Lahiri, Mr. Chayan Roy Chaudhary, Mr. Urvashi Kaushik, and the entire team of 12 collaborating civil society organizations and their network of 300 community volunteers are really praiseworthy for capturing ground level voices and lending this as a grateful exercise for their purposeful and profound engagement in this process. Thanks are also due to our own committed team in IHD, led by Professor Tanka Endo, Dr. Tanushree Kundu, Dr. Prashant Arya, and our own advisors, Professor Ravi Srivastav, Dr. Alak Sharma, and ably supported by the production and organizing team and at the anchor, Priyanka Tyagi, Dr. Aditi Madan, Jyoti Giri, and many others who actually make it possible, this program possible. We thank all the participants for their committed involvement in this process. And lastly, to all those who have worked as a team in UNICEF and IHD in continued joint effort in organizing, supporting today's program and making it a great success. Thank you very much.
Thank you all.
Yes, thank you, Dr. Sriranjan. And this is just a general announcement. Now the report is available on the UNICEF and the IHD website in downloadable formats. It is all out for dissemination, a very nice and a pertinent issue, which is all out for dissemination. Thank you all for joining. It is, for me personally, indeed a great honor to share screen space with all the luminaries present on the screen at the moment. Thank you to all the attendees. Thank you very much.
Thank you.
Thank you.
Thank you. Thank you, everyone. Bye.